Good morning. My name is Sujit Chana, and I'm the chair of the board of directors at Care for the Homeless. And I want to welcome you today to today's seminar. We are fortunate to have Dr. Jill Khadduri with us today to talk about a book she co-authored called In the Midst of Plenty, Homelessness and What to Do About It. The book is an absolute must-read for anyone wanting to understand the current crisis of homelessness, including how we got to where we are and how we can implement proven solutions with the right resources. We're also joined by a distinguished group of panelists who will help us deliver deeper insights into the research and center the conversation on what is happening in New York City. A key part of Care for the Homeless mission is to prompt discussions about important policy issues that impact the individuals that we serve. We achieve that by convening service providers, advocates, and folks with lived experience and policymakers to discuss opportunities to not only respond to the immediate crisis of homelessness, but to contribute to the long-term solutions. Thank you for taking the time to participate in what is undoubtedly be a very rich and interesting conversation. I would like now to turn over to the President and CEO of Care for the Homeless and the moderator for today's panel, George Nashak. George?
Thank you, Surjit, and welcome to all of you. Recognizably professional services to address homelessness have a 55-year or so history. Over that time, a substantial literature has developed about the magnitude of homelessness, the characteristics of people experiencing homelessness, and the effectiveness of programs to prevent and end homelessness. Some of this literature consists of polemic, some comprises opinion pieces, but increasingly there have been academic research papers using social science methods to assess and analyze the problem and its potential solutions. This literature is published in a variety of journals, and the practitioner or layperson is challenged to develop an integrated understanding of homelessness. In the Midst of Plenty, Homelessness and What to Do About It, Jill Khadduri and Mary Beth Shin's outstanding book about homelessness in the United States offers a comprehensive assessment of the problem and the programs that have been attempted to address it. It is, in my view, the most important single volume on the topic to have been published in the last 20 years. Jill and Beth, who have themselves made some of the most significant contributions to the literature on homelessness, have provided us with a fact-based overview of the scope and characteristics of homelessness in the United States, a comprehensive portrait of the population of people experiencing homelessness, and most importantly, an assessment by two of our most competent judges of the effectiveness of programs designed to prevent and end episodes of homelessness. The authors provide us with a straightforward, level-headed assessment of the programs that have been proven effective by the tools of social science. They have also analyzed programs that are well-intentioned, but have not been demonstrated to be effective. In the Midst of Plenty should be read by all of us who are practitioners, but more importantly, it should inform the decisions we make about where to invest resources to ensure that we have the greatest impact on the problem we're trying to address. Jill Khadduri is a principal associate at Apt Associates, an organization that conducts research on efforts across the US to improve the lives of vulnerable people. She has been a senior member of many research teams studying policies to address homelessness. She has been co-principal investigator for the annual homeless assessment report since 2007 and is a member of the Research Council of the National Alliance to End Homelessness. Before joining Apt Associates in 2000, Dr. Khadduri was director of the Division of Policy Development in the Office of Policy Development and Research at the U.S. Department of Housing and Urban Development. It is my great pleasure to introduce Jill Khadduri.
Thank you so much for that kind introduction, and thank you, George and Surjit, for giving me the opportunity to talk about the book and to join what I think will be a really interesting and valuable panel discussion. Again, this book is called In the Midst of Plenty. It was published in March 2020. It was the result of decades of research on homelessness, both by Beth Shin and me, or research that we participated in, and we also did an extensive review of the research on homelessness up to that point. So we have attempted to treat the topic comprehensively, and the book also includes a fairly extensive bibliography and index. And I'm really glad that we do that, because I often look in the index myself. So we divided the book into basically 4 questions. Who becomes homeless? What causes homelessness? How do we end homelessness? And how do we prevent it? So first, who becomes homeless? We decided to focus the book on literal homelessness, that is to say, the HUD definition of homelessness as being in shelter or in a place not suitable for human habitation. So we don't focus particularly on doubling up. And here are the numbers. They're updated a bit from what's in the book, because but the patterns are basically the same. There is not a good number for 2021 because of the disruptions in doing the point in time count. So here's the number for January of 2020. About a little over 500,000 people were counted nationally. And over the last year that we have data from, over the course of a year, this is from the Homeless Management Information System, the number who experience homelessness at some point during the course of the year is about 1.5 million. And but it's also the case that the numbers are much bigger if you look at who experiences homelessness at some time over the course of their lifetime. An early study, it was done a couple of decades ago, based on a survey of the US population, found that 7% of the US population at that point said that at some point in their lifetime, they had experienced an episode of homelessness. And that number, if the survey were done now, it would probably show a bigger number. Now, the effect of the pandemic has been to reduce family homelessness, but not by individual homelessness. And we'll maybe talk a little bit about that during the panel discussion, why that came to be the case. So here are some key demographics, and this all comes, now, as George said, I have been co-principal investigator of the annual Homelessness Assessment Report, or AHAR, for ever since that HUD report started in 2007. And again, I'm showing you recent data, but the patterns have not really changed very much since Beth and I published the book in early 2020. So first of all, the sheltered population. Over the course of the year, about 2/3 of people who experience homelessness do so as individuals rather than as family members, rather than as members of families with children. And if you look at people just at a single point in time, a little over half are individuals, and a little under half are members of families. Now, the numbers are somewhat different from New York City. The split between family homelessness and individual homelessness is more even in New York than it is for these national numbers. Now looking at the unsheltered population, more than 90% experience homelessness on the street as individuals. Very few children are on the street, but some are. And then, something that we've seen ever since these data were first looked at is that homelessness disproportionately affects people who identify as Black African American. We do a comparison for the national population in the AHAR, but we also make the comparison to the poverty population to show that this is not just reflecting a rate of poverty. Heads of families in shelters are 58% Black, whereas they're only about a quarter Black in the poverty population. Now, and there's a common, and homelessness also, the numbers of course are much smaller, but homelessness also affects Native Americans disproportionately. Now there's a common perception that homelessness results from mental illness, and that's how modern homelessness used to be perceived. But the homeless management information system data show high numbers of people without disabilities use shelters. Half of all individuals have no reported disability, and 3/4 of adults in families also do not. So why do people become homeless? In the book, we make 3 arguments for showing a central thesis of the book, which is that homelessness is essentially a housing crisis. And we make that argument in 3 different ways. First, we look at history, then we look at geography, and then we look at effective policy. So in the book, we go through the literature on poverty and inequality, showing why they are so pronounced in the US compared with other developed countries. The deep poverty that is a phenomenon that particularly affects the United States among developed countries. There's much less deep poverty in European countries and in Australia and New Zealand or Canada. Deep poverty combines with high housing costs to create a housing affordability crisis. And then there are factors that heighten risks for particular people, and we spend a lot of time in the book talking about that. So modern homelessness emerged in the 1980s when rents became increasingly unaffordable. This exhibit shows the number of rental units that households in the bottom quartile of renters could afford. And as you can see, the numbers turned negative starting in about 1995 and then continued to be worse. I mean, as the modern crisis of homelessness unfolded. So that's the argument from history. That's when modern homelessness began, and clearly there's clearly a relationship between when housing affordability also became severe. Now this is one of the arguments from geography. Every year, the National Low Income Housing Coalition publishes this map. It's called Out of Reach, and it shows the hourly wage that a full-time worker must earn, working 40 hours a week, 52 weeks a year, in order to afford the fair market rent for a 2-bedroom rental unit without paying more than 30% of their income. And only in the light blue shaded states is that less than $16 an hour. In the dark blue states, it's more than $23 an hour. And those of you familiar with the geographic distribution of homelessness will recognize a pattern here. I mean, look at Washington, look at California, look at New York, look at Massachusetts. And here, this basically shows the same thing, that homelessness is most common in more expensive rental markets. The percentage of the population that experiences homelessness is on the left axis, and then on the right, on the bottom axis is the median rent. And again, you can see in the bubble, you can see places that have very high percentages of people experiencing homelessness, and very high numbers as well as percentages. Now, the third argument that we make to show that homelessness is essentially a housing crisis is that the randomized controlled trials, both of which were conducted by my company, Act Associates, provide compelling evidence. First of all, we randomly assigned welfare families, families referred from TANF agencies, to either get access to a housing voucher or not. And access to a voucher essentially prevented them from becoming homelessness over the next 4 years. And then the other study, which I'll be talking about more, it's called the Family Options Study. And Beth Shin, my co-author on the book, was also co-principal investigator on that study. In this case, we randomly assigned families found in emergency shelters to different possible interventions. And what we found is that access to a housing voucher and the rate of use of those vouchers was very high, substantially reduced returns to homelessness over the next 3 years. So, some people are especially vulnerable to experiencing homelessness. And in the book, we go over various factors that lead to this vulnerability. And we talk about income, we talk about wealth, we talk about housing, we talk about incarceration. I'm going to focus today on racial minorities and show why historical and persistent discrimination that affects wealth, income, and housing explains why homelessness is more common among Black families than among white families. And in the book, we also review the evidence on discrimination faced by people with disabilities and people returning from incarceration. So income disparities. This comes from a paired testing study that was done some years back that shows that the discrimination against people who are identifiable as Black. I mean, they have people who were using names that seemed to be the person on the other end of the line to belong to Black people, and then other people who did these pair testing calls had names like Emily and Greg, and what that study discovered is that the difference in callbacks from people who called and said, "I'm interested in a job," was the equivalent of 8 years of experience. I don't think I showed this slide yet, but this is the slide that I was talking about before. And in 2018, the data that we present in the book showed that Black men earn only 75% as much as white men, and Black women only 80% as much as white women. And that for the past 3 decades, unemployment has been roughly twice as high for Black people as it has been for white people. And then there's also the wealth disparities. And you may be familiar with the book by Richard Rothstein called The Color of Money, very powerful book. And what this shows is that historic patterns of exclusion from the ability to rent, to buy a house or to buy a house in a good neighborhood have created wealth disparities that have a profound effect today. And in 2013, and I don't think it's very different now, the median white families had net worth 13 times the median net worth of the average Black family. And then there's incarceration. The US, as we probably all know, has the highest rate in the world. It's improved somewhat since we published the book, but this is another thing that disproportionately affects Black people. And people with disabilities face many different kinds of social exclusion, low benefit levels from SSI income, for example, little ability to accumulate wealth, high levels of incarceration, and there also have been paired tests that have shown housing discrimination against people with disabilities. So how do we end homelessness for people who are experiencing it? And this, again, this is a slide about this family options experiment that we started it several years ago, and we're still following about 2,000 families with children and measuring the impacts of either giving them access to housing vouchers, giving them access to transitional housing or rapid rehousing, or leaving them to find their own way out of shelter. And the family options study, again, not only found that housing vouchers reduce returns to homelessness, but they have these other radiating benefits on family separations, on child welfare, on food insecurity, on behavioral health challenges, and few families turned out to be not eligible for vouchers, and there was very high take-up, and very high ability to actually use the voucher and keep it over time. And what we found is that it only cost about 9% more to have vouchers available for people than it did to let them find their own way out of shelter. Now so that's families. This is individuals, and this comes from the literature on housing first, and more specifically the Pathways Housing First program in New York City. And what this shows is that the staircase model, in which first you go to a shelter, then you go to transitional housing to help you solve your problems, and then finally you get permanent housing. Housing First bypasses the staircase, and with ongoing flexible supports gives people immediate access to independent permanent housing with supportive services available but not mandatory. And again, another randomized controlled trial that was done of this program showed that it worked. That people with mental illness and other health and other challenges were able to be stabilized in housing and to stay there. So how do we prevent homelessness not for people who are two chapters on prevention. One chapter is on how you prevent homelessness for people who are on the brink of experiencing it, and the other is how do we stop generating homelessness. So we make an argument in the book that prevention programs, and this is really Beth Shin's special area, or one of her special areas of expertise, is that prevention programs should not be triage programs. They should be focused on people who will benefit most. If you actually see a prevention program that seems to have a 99% or 90% success rate, that probably means that you're targeting it to the wrong people. So we know that some prevention programs have worked. I already talked about evidence from a randomized controlled trial that shows that access to housing vouchers prevents homelessness for families with extremely low incomes. There are also a couple of very solid studies about the New York City program that probably everybody watching this is familiar with, called Home Base. And And there's good evidence that the home-based approach worked, and also there's also some pretty good evidence that providing people cash to prevent them from being evicted when they really are on the brink of eviction also works. And there's some approaches that we think have worked. Legal help or mediation to prevent evictions. Shallow rent subsidies also may work, and one of the reasons that we think that veteran homelessness went down is that the Veterans Administration, when somebody comes to the VA for medical services, they get asked a few questions about their housing situation, and then the VA can target help to people who they know look as though they're on the brink of experiencing homelessness. So then the final chapter in the book talks about how we as a society can stop producing homelessness. And I mean, first we talk about how we can have a broader social safety net for housing. This chapter is essentially all about the weak social safety net in the U.S. and how it can be strengthened. First of all, we can expand the housing voucher program. I've already shown evidence that the housing voucher program successfully gets people out of homelessness, and it also prevents homelessness. We could add similar local and state programs to the extent that the federal program is not expanded, but I'm a very strong advocate for expansion of the federal voucher program, and the book goes over some of the evidence of what it would cost if we made the voucher program an open enrollment or universal program. And then on the supply side of the housing crisis, another thing that we should do is, and this is something that is can be done at the local level, has to be done, or pretty much has to be done at the state or local level, is to change the zoning and other regulations that prevent adding to the supply of housing. So, I mean, people can't afford housing because housing is expensive, but they also can't afford housing because they have low incomes. Those are, two sides of the same coin. One of the things that we could do is raise the minimum wage. And in the book, we go over some of the research evidence on raising the minimum wage. As you probably all know, raising the minimum wage is controversial because it's thought that it would reduce the number of jobs, but there's strong research evidence that modest increases in the minimum wage would not do that. Another thing we could do is enhance the earned income tax credit. We could broaden the social safety net by increasing enrollment and benefit levels for food stamps or SNAP, for TANF, for the SSI and SSDI programs for people with disabilities, and we could increase the child care part of the safety net. We could also reduce income volatility. And then the other thing that we could do and should do is to combat social exclusion. In the earlier part of the presentation, I went over the evidence from the book about the extent to which homelessness is in fact a product of systemic racism in the society. We could more strongly enforce the affirmatively furthering fair housing requirement that's in the civil rights legislation of the Fair Housing Act of 1968, and we could enforce existing laws against discrimination, and many places, including New York, have a prohibition against source of income discrimination, which means that an owner of rental housing cannot deny renting to someone with a housing voucher just because they're using the housing voucher to pay part of the rent. But it's not enough to have source of income laws on the books. You've also got to enforce them. So here we are, the authors. Mary Beth Shin, who is a professor at Vanderbilt University, and she was at NYU for many years. And my company, Act Associates, is a national research firm, and I have many colleagues in New York City. So I think I have ended the presentation a few minutes early, which is probably fine because I think we're going to have a great panel discussion. And if I can manage to get to where I can stop sharing. There we go. Okay.
Thank you, Jill, for that excellent presentation. I'd like to take a moment now to introduce our panel. We've assembled an excellent panel today to start the question and answer portion of the webinar. First, we have David Brand. David is Deputy Editor of City Limits, a recent promotion for which I congratulate him. David is one of the most prominent journalists in New York City covering housing and homelessness issues, and is a wonderful addition to our panel this afternoon. Next, we have M.A. Dennis. Dennis is a poet and consumer advocate at Care for the Homeless. He uses the written and spoken word to advocate, educate, and share his lived experience to amplify the voices of the voiceless and to document the correlation between housing and mental health. On a personal note, he is also someone from whom I have learned an enormous amount about the experience of homelessness. Our third panelist is Molly Wasow Park, who is first Deputy Commissioner at the New York City Department of Homeless Services. At DHS, Molly is part of the senior leadership team, and she's in practice the Chief Operating Officer, if I can say, of DHS, and is therefore responsible for translating policy into programs on the ground. And that's a perspective that I think makes her an ideal commentator for our panel this afternoon. So let me begin, we'll go, I guess, alphabetically. David, can I invite you to ask the first question to Jill, please?
Sure thing. Thanks for that introduction, George. And want to just say hi to Dr. Khadduri and thank you for, doing this discussion, and thanks for Care for the Homeless for the opportunity. Like George said, I'm deputy editor at the news site City Limits. I cover housing and homelessness. In my previous career, I worked in supportive housing and homeless services. And Dr. Khadduri, I wanted to discuss your perspective on media coverage and homelessness, coming at this from my journalist perspective. But I wonder, has coverage of homelessness matched the reality of homelessness that you describe in the book, the extent of the problem, who becomes homeless, the drivers of homelessness? And how has reporting on homelessness evolved in the past several decades?
Well, reporting on modern homelessness began in the 1980s when it began to be evident that a lot of people were on the street, and that the use of shelters was growing, and it's at the early reporting on homelessness, I think, was not terribly well informed by the evidence, but as we started to have better and better data on who actually experiences homelessness and what the numbers actually are, I think by and large, the coverage of homelessness by the media got pretty good, and that journalists, looked at the numbers and interviewed researchers and tried to get it right. I've given, and my colleagues at APT have given a lot of interviews to the press, and I generally find that that they're listening to the evidence, they want to know the evidence, and generally they're getting it right. I mean, not exclusively. I was interviewed by somebody, and I don't even remember what this person's name was, but it was somebody in New York City who kept emphasizing NIMBYism that was preventing shelters from being built in certain parts of the city. And I kept saying, no, New York doesn't need more shelters. New York needs more housing. And I was having a hard time sort of getting him off what I thought was, not the right way to think about it, but that's quite unusual. I think that that pretty much in the press coverage of homelessness has gotten pretty good.
Thank you for that. And I will point out to the folks participating this afternoon that David's journalism on the questions of homelessness and the homelessness policy are some of the most sophisticated work we have in New York City. I might not describe the New York Post's demonization of homeless people on a routine basis in the same way, but
Right.
let's not go down that road this afternoon. Dennis, do you have a question for Jill, please?
Yes. I know it's against the rules. I'm gonna sneak in a question that I just want you to ruminate on, but not to, only because it's connected to the media question. I'd like to know, how do you feel about when you see headlines that start off where they make mention that the person was homeless? So that's not my question right now, but I just would like for you to think about and whether or not it's always relevant to the story itself to point out, with the first word that the person is homeless. But my question is, because I was looking at some of the Q&A and stuff, and I think a compliment that I'd like to give you on this book, Dr. Khadduri, is I think that this book in certain places of the country would actually make it on the banned books list, because you started talking about some things like redlining and housing market bias, like how if they thought it was a Black person, it was different from if they thought it was a white person. So my question is, and it's kind of like I have a movie kind of theme about it, is in the movie The Matrix, Morpheus, he said to Neo, I'll show you how far the rabbit hole goes. So my question is, in terms of intersectionality with homelessness and with people specifically African American, how far does the rabbit hole go with institutionalized racism and in terms of discrimination playing out as a cause of homelessness?
Well, it goes back centuries, of course. This is not not a new phenomenon, it goes back to the history of slavery. It goes back to the racial attitudes that are born of fear and guilt. So I'd say it goes back pretty far.
If I could just a follow up to that very quickly. For me, I can understand why there are people who don't want to get into the history, because me seeing my ancestors, it's even difficult for me to see the things that were done.
Mm-hmm.
But such radical oppression was carried out. So I guess my question is, what is the remedy? Because it seems like, I'm someone, I get a housing voucher, I'm very thankful for it. But it feels like the solutions aren't as radical as the oppression. So I'd like to know, like, what do you feel is some of the solutions, and is it sufficient, or does it need to be more?
Well, I mean, again, as you've seen, I'm a big advocate of expanding permanent rent subsidies or long-term rent subsidies, as I prefer to call them, because the permanent implies that people, use a housing voucher for a lifetime, and they don't. But we look closely at whether there are racial disparities in the ability to use vouchers, and the good news is they're not. As we know, and we'll probably talk about this some more, not everybody succeeds in using their vouchers, but success rates are not systematically lower a couple of colleagues and I published an article, again, based on this family options data, in which we really wanted to see whether the high success rates for the family option sample as a whole, for those who were given access to vouchers, whether those were the case for Black families as well, and we found that they were. And so that's the good news. But you're also asking a more profound question, which is that, should we do more than that? And that's a complicated discussion, but I think that there's certainly, one of the things that's increasingly happening is that public housing authorities are focusing on people experiencing homelessness, and I think that because of the disproportionate way in which homelessness affects Black people, both families and individuals, I think that focus on people on having vouchers go to people experiencing homelessness is one of the ways that we can use public policy to overcome these systemic problems.
Thank you.
Thank you both. Molly, you have a question for Jill.
Thank you. And let me first just by thanking you for hosting the panel and for including me. It's really a pleasure to be here with this group. I want to, before I get to my own question, want to start really by echoing what Dennis said about press coverage. I think absolutely there is a certain genre of coverage that of local events in New York City that where homelessness is it's used almost as a code word for race. It has almost no relationship with reality. I think it is incredibly biased, really, and intended to fearmonger about people people with low income. And so I absolutely think there is a pervasive media bias, present company excluded, but that we see quite often.
Those are not the articles I read, and those are not the reporters that I talk to.
I wish I could avoid them in my role. They're front and center. I actually wanted to talk a little bit about what it would take on a really practical level to be using vouchers as a large scale homelessness prevention tool in a city like New York. So let's assume away the financial constraints, right? So that we actually have the extreme ramp up of vouchers that you talked about, right? But we know in New York City that low-income families, many of them are doubled up. Just a few weeks ago, there was data that came out around the federal definition of homeless students, right, which does include doubled up. So, a fairly small minority or a minority of the children experiencing that they defined as homeless in New York City last year were ever in shelter. much larger share are doubled up. We also know, is looking at housing vacancy survey data, other sources, that there's a lot of units, and particularly the lower rent units, that wouldn't pass housing quality standards for vouchers, right? So if we want to be able to use vouchers, and you can't use a voucher, and if you're doubled up, you can't use a voucher if the unit doesn't meet those quality standards. If we want to actually be talking about using vouchers as a homelessness prevention tool, do we need to change our standards? Do we need to change the program? Do we need to be thinking about things differently?
Well, I mean, I think I agree with you with the implication that vouchers ought to be able to be used for shared housing. I think that's something that HUD has toyed with, but really hasn't pursued as aggressively as it should be. Housing quality standards. And I mean, there are changes sort of in the wind about housing quality standards. Things like, letting people move in if the failures are not life-threatening. But, letting people move in, and then again, giving the landlord time to make the repairs, which are often pretty modest repairs that are necessary to make the unit pass HQS. And one of the things that could be done is to provide owners a modest subsidy to make those repairs. I think that's I'm not sure how to design that exactly, but I think that's what you're saying is that New York City has a substantial housing stock, obviously many units, and many of them do need some repairs in order to bring them up to housing quality standards. I also think that sometimes we sort of exaggerate the extent to which vouchers can or can't be used. It's kind of the case of, is the glass half empty or is the glass half full? Because many vouchers are used. My colleagues and I did a study in the Los Angeles region over the past year, in which we actually got access to the transaction level data for vouchers. So we were able to measure the success of people across Los Angeles, the two big housing authorities, and the smaller ones as well. To what extent did people who were homeless at the point that they were issued their vouchers, to what extent were they able to use them? Well, 2/3, some 65% were able to use their vouchers in the Los Angeles housing market, which is also a very difficult and expensive housing market. So I'm saying that the glass is 2/3 full. And somewhat surprisingly, we found that people experiencing homelessness at the point when they got their voucher had a slightly higher success rate, not a lower success rate, than people who weren't experiencing homelessness at that point. And we think that well, there are a couple of explanations for that. One of them is that a large fraction of the people who were issued vouchers because of the set-asides of the two big housing authorities in the LA region, a lot of them had case management. Then they had help navigating the process and getting through the eligibility screening and then using their vouchers. And they also at that point, there were also signing bonuses for landlords who were willing to accept a tenant who was leaving homelessness. And so that's another thing that can be done is signing bonuses to encourage owners of rental housing to accept people who are using the voucher to leave homelessness.
Continuing this conversation for a moment, here we have two examples, New York and Los Angeles, very, very tight housing markets, very low vacancy rates, particularly at the low end of the housing market. Is the voucher strategy going to be successful if the locus of implementing it are in these tight housing markets? If we morphed into a more national housing policy where people could move more easily into marketplaces where the vacancy rate was much higher and the cost of living much lower, it feels like we're trying to solve this housing problem in the worst possible environment in either New York City or Los Angeles. Would a national housing policy move the needle on that problem somewhat?
Well, in theory, vouchers are portable, and that actually happens. That is to say, if you are issued a voucher in New York City, you can use that voucher to go to someplace else where the housing may be more affordable. And I don't know what the statistics are for NYCHA HPD and how much portability there is. I can remember anecdotally hearing about a fair number of vouchers that had been used portably to one of the cities in Pennsylvania. I don't remember where exactly. But I mean, the portability feature is clumsy. It requires figuring out, who pays the subsidy to the receiving housing authority, and so it's not always fully implemented, but we do. I mean, the federal housing choice voucher program is a national program. It's national, but it's also sort of tight. It's adjusted for the different rent levels in different parts of the country.
But people's home decisions about where is home are also not purely economic decisions, right? People,
Absolutely.
We see that even
Absolutely.
about moving within neighborhoods. People are connected to church, to job,
Right.
to doctors, to family, and leaving that is really difficult.
Right. So you have to, you appropriately have to have to solve the problem, in the community where people have roots and people want to stay.
Great, thank you. David, could we go back to you for another question?
Yeah, the stuff about vouchers is really interesting to me and something I've done a lot of reporting on. And you had mentioned in your presentation about, creating rules to foster lease ups with vouchers and access, but then not funding the enforcement of that. And so something that, I've reported on, a lot of people have reported on, is just the lack of enforcement when it comes to voucher discrimination. Now, what could the city do to increase that kind of enforcement? Or and do you think that's the biggest problem when it comes to voucher use, or what are some of the other obstacles you see?
It's a very big problem in some places. That is to say, I don't know in New York City how, what the extent of discrimination against voucher holders is. And I do, there was a study of that tested voucher discrimination a couple of years ago, and it varied. It huge variation in different cities and different parts of the country. One of the places where the discrimination against voucher holders was not very very high is in the city where I live, which is the District of Columbia, which has had source of income laws for a long time, and has had a lot of enforcement of those source of income laws by local fair housing groups.
Dennis, do you have another question?
Yes, have another 1.5 questions, because I promised, I saw someone in the Q&A, they did want to know about, if Dr. Khadduri, if you could speak about the connection between healthcare and homelessness.
the connection between, okay, health, healthcare is there. I'm stumbling around because there's so many new places I could begin. First of all, people who experience homelessness often have fairly substantial health care issues. As we've watched the data over the years, we've discovered that the age profile of people experiencing homelessness is increasing. It's still the case that very few people who are over 65 years old are on the street or using shelters, but people who are over 50, the numbers who are over 50 or over 55 or over 60 keep growing. And there's a lot of research going on, really good research about that people who with the kind of healthcare challenges that come with aging and people who have had long experience of homelessness age faster. That permanent supportive housing is often now challenged because they're serving people who need assistance with activities of daily living. They don't just need connection to voluntary healthcare services. I also think that the system often isn't providing enough of those voluntary behavioral health services that the changes are happening. That's happening more, but it's one of the places where the broader homeless services system still needs a fair amount of work. Another thing, by asking this question, another thing you made me think about is that emergency rooms, maternity wards are not bad places to screen for housing instability, to screen for risk of homelessness. But what we've learned from interviewing people on both sides is that the healthcare system is often frustrated because if they refer people to the homeless services system, there's nothing for them. And the people who run the homeless services system say that the healthcare systems don't do a terribly good job of identifying people who need help. So that's another area that needs a lot of work.
Well, I will resist for the moment a pitch for those of us who are homeless healthcare providers integrating services into shelter in New York City, just to give Dennis the opportunity to ask his question, not the one that he picked up from the Q&A.
Yeah. Okay. There's a wonderful quote that you used in the book in the introduction by William Wordsworth, where he spoke about being homeless but surrounded by 1,000 homes, and being hungry but being surrounded by 1,000 tables. And it's interesting because you said right there that in the midst of plenty, right? So it's like the resources are there, but how do we access the resources, right? So to me, I feel like it often feels like homeless people, we're starving. We are literally starving. We want to eat, and we're surrounded by tons of canned food, but we don't have a single can opener. So what is the can opener? How do we not starve when there's all this food around us, but we just don't have the means to access it?
Yeah, I mean, it's hard for me to understand why we don't have the political will to have a stronger safety net in this country. I mean, we have the resources to do it, but we don't. We don't find ways to access the wealth that is in the society and use it in the way that we should. And I'm not, and maybe that gets back to the question of press coverage and the press coverage of homelessness might focus more on these kind of fundamental structural issues and less on the immediate story. But that's what that William Wordsworth quote is all about, is that, we could do it. We're a wealthy country. We just don't.
Molly, do you have another question?
Yes, thank you. So one of the things that really intrigued me in the book was, and in your presentation, was a discussion that support services outside of the supportive housing context, but for most households and individuals, support services after leaving shelter basically plays zero relationship in people's housing success. I am told every day by big landlords, small landlords, property managers, affordable housing developers, market rate developers, public housing, right? You name it, across the spectrum, that in order for clients coming out of the DHS system to be successful in housing, what we need is aftercare. And if I had $1 for every time I heard the phrase aftercare, right, we could solve all of these problems again and again and again. So interested in what you think about why is this so pervasive and understanding, right? Is there actually something, is it possible that there's something on the ground that, people running buildings are seeing that doesn't factor into the research? Is it, or where does this misconception come from? If we do think it's a misconception, why is it so pervasive, and what would you do about it? Because I've actually gotten to the point where I have started aftercare programs less based on any particular data point, but more because I can't place people if I don't have it. So I'm going to have it no matter what it looks like.
And so do you think this is a misperception among landlords or housing managers that anybody who has experienced homelessness is not going to be a successful tenant?
Well, I don't know. This is something I've really wrestled with. I mean, that's sort of why I'm asking for your take on it. I do think there's some of it that, when your kids are noisy, it's because kids will be kids. And when my kids are noisy, it's because I'm coming out of the shelter system, right? I absolutely think that there is some of that. I do think there have been, a limited number of very real and very painful incidents of, particular instances that have been challenging with people coming out of shelter. And I do think that colors it, but it is difficult for me as a practitioner to dismiss a perspective that I hear so incredibly pervasively, even though but then I'm trying to figure out how to match that with the research that
Right.
you present, which is that there is basically zero relationship.
Well, I think it depends on which part of the population of people experiencing homelessness we're talking about. I mean, certainly people with mental health challenges, behavioral health challenges, need aftercare. Probably the first time I got into this topic was many years ago when I was still at HUD, and HUD supported a demonstration that was trying to reform systems of mental health care, and in fact, somewhat to our surprise, people who had severe mental illness were able to use tenant-based rental assistance, and what we heard is a number to call. That is to say, what a landlord wants is to know that if they have a problem with a tenant, here's a number to call. I mean, here's somebody who can help you solve the problem, so you're not on your own And maybe that implies, but you're talking about families with children, and and as I said, from the family options study, we found that families with children were able to sustain using their vouchers in the rental housing that they rented. But to the extent that there's a perception that families, that families who have been in the shelter system are not going to be good tenants, then light aftercare, that is to say, light case management, not constant interaction with the family, but just having a problem solver there, and having the owner of the housing know that there's a number to call.
But would you agree, Jill, that we sometimes treat homelessness as sort of this monolithic population, and to say that people leaving homelessness with a voucher into housing need X or Y,
Right.
I think we need to titrate that into the subpopulations a little bit, and then match the level of service to the need of the person,
Right.
not necessarily make these broader conclusions.
Well, and that's what I was saying, that families with children, most of whom are not struggling with mental health or substance abuse issues. They're experiencing homelessness basically because of deep poverty. And so, a lighter touch solution is appropriate, where and then on the other end of the spectrum, we're talking about the people who've spent a long time on the street and have serious health issues. There's a high level of care at that end of the spectrum, a high level of aftercare needed, or as I was saying, that people that providers of permanent supportive housing are sometimes struggling whether the population they're being asked to serve really belongs in housing or needs to be in some higher level of care.
Sure. We do have a number of questions that were submitted ahead of the panel, and some that are coming in through the Q&A, but let me take another round through our panelists here to see if folks have a final question to ask. David, do you have another question for Jill?
Yeah, and I'm just looking at the conversation in the chat. It's really interesting to get people's perspectives on a lot of these issues. So yeah, keep them coming. I put my email and my phone number in there, so I'm hoping some people here will reach out. But yeah, Dr. Khadduri, you had talked about structural problems and, kind of related to reporting, that people focus on like one-off stories, or I think it's like, this shelter stinks. There's a problem at this shelter. Important stories to tell, so probably create change and like an acute problem. When you talk about these deeper structural issues, I think New York City and New York City government and the Department of Homeless Services gets blamed a lot, and it's almost like an easy target. But there are so many other parties that bear responsibility for problems like housing agency not creating enough homeless set-aside units, or the state for the last 2 decades cutting funding for homeless services in New York City and really shirking its responsibility to homeless services. The private market, as we talked about, voucher discrimination, housing discrimination. So can you talk about some of those other parties that are not like New York City and the Department of Homeless Services that really bear responsibility for perpetuating this crisis, and what needs to change?
Well, I think I certainly would like to see in-depth reporting around what needs to change. I don't know. I mean, you mentioned the housing authorities, and both of the big housing authorities in New York City have preferences for people experiencing homelessness. What I don't know is how well does that work? I looked, as there have been these new allocations called emergency housing vouchers, and HUD has a dashboard that that you can go to and see what's the rate of lease up. The rate of lease up of those emergency housing vouchers is not particularly good for either NYCHA or HPD. And I don't know the story behind that. I looked at some other large housing authorities, and the New York housing authorities have about a 25% lease up at this point. Other big city housing authorities are probably more like, and it's often more like 50%. I mean, it takes time to use this new resource, but it takes a lot of. I mean, what I've learned from other interviews that we've done in California is that it takes a lot of work. I mean, some cities that have very high housing costs have been able to use all of their emergency housing vouchers, but what's been described to us as we've interviewed them is that they have sort of daily contact between the homeless services system that is referring people for those vouchers and the frontline staff at the housing authorities who are trying to help people use them.
So
Molly,
I can
Molly,
definitely
I was going to invite you, but I didn't want to put you on the spot.
I can definitely talk about EHV in New York City. I can assure you there is beyond daily contact. I think one of the things that is really different about how New York City has approached EHV, different from how housing resources have been approached in the city in the past, and I believe, from what I understand, different from other housing authorities, is we actually have a vast array of what we're calling referring agencies. So about half of the city's EHV vouchers were allocated to Department of Homeless Services, and that we're placing through we're using to help our clients access housing. But there's also a lot of vouchers that were allocated to the Department of Youth and Community Development, to the domestic violence agencies, to children's services, to, I mean, there's, I don't know, 15 different allocating agencies in the city, which means that you're actually reaching a much broader population that has had access to housing supports in the past. There's real reasons to allocate affordable housing resources to people who are experiencing homelessness, but it also means that there's a whole world of people who are facing very real housing stability challenges who haven't had access. So with EHV, we're reaching those populations, but you also have systems then that don't have the same kind of experience serving as housing resources that Department of Homeless Services does, right? So we have a shelter system where virtually every shelter has housing specialists, and we know how to get it done. And that's not to say that we haven't run into our own challenges. It's really hard to find apartments. It's, for better or worse, the city's housing subsidies are now calibrated at the same rent level as the EHV vouchers. So you have an enormous number of people with subsidies all at exactly the same rent level, right? So, there are real challenges. There's the quality challenges that I talked about earlier. There's all kinds of other things, but DHS has some infrastructure. The other half of the vouchers are with agencies that really don't have that same kind of infrastructure. So, we were able to get started a little faster than some of the other agencies. I think people are now catching up, and then we are all wrestling with some of those the structural things. I think, David, I appreciated your comment. We at DHS often refer to ourselves as sort of the safety net of the safety net, right? Once you get to DHS, there's a lot of parts of government that have failed you already, right? And we are very often being reactive. And, the state of the housing market is a part of that, right? Both the rentals that are available, the price point, the quality, right? Those are all things that we as the Department of Homeless Services can't affect.
I'd love to follow up if I could.
Yeah, please go right ahead.
The phrase that you said, Molly, certain parts of your government have failed you. It actually was tying into what I wanted to my final question to Dr. Khadduri, because when she talked about political goodwill, well, the thing is, especially this, we just had this, this was election week. I realized that it is intentional, that there are parts of government, certain aspects of our government, that the failure is intentional, and they do not care, So how do you deal with, if it's no goodwill, if there's no goodwill, how do you overcome that? I mean, so, to tie it, and the other thing, if you're a woman and you want to have control over your body, and now it is said to you straight up, you now have realized that there are people who do not care about that. And, and you realize you're homeless and we can solve this problem, but there are people who do not care about that. How do you deal with that?
And if I may, Dennis, supplement your question with a great question that came in through the Q&A. It's not simply that, yes, there are folks that don't care, but we also have a very significant political voice in our country that is attempting to undermine the safety net, Jill, that you've identified as being essential to keeping people out of the condition of homelessness. So please give us some encouraging words, particularly this week, about how we might proceed.
Well, again, I think that, somebody made the good point, actually more than one person made the good point, I know Dennis among them, that that homelessness is often characterized as a basic part of an essential characteristic, something that, if you've ever experienced homelessness, then you're a homeless person. And I think there's a lot of misperception. There still is a great deal of misperception about that, about the fact that homelessness is a temporary condition. It's not an essential part of people's being. And so that I think that there's a lot of it, and maybe this also gets back to potential press coverage, the educational role about telling stories of people who have had the bad luck to fall into homelessness, but that's not who they really are. I mean, they had a housing crisis, they became homeless, or maybe it was a job crisis, or maybe the person who was providing them housing died and they didn't have any place to go after that. But that, I mean, I think that's a story that we need to keep emphasizing, that homelessness is not something, something like whether you have blue eyes or whether you're that is a kind of an essential characteristic.
Thank you. Molly, another question?
Yeah, thank you. So there was a very brief allusion in the book to predicting who is going to be, this wasn't your words, these are mine, but a long-term stayer, right? Some family or an individual who is likely to stay in the shelter system a long time. And as we think, as much as I would love for there to be large-scale vouchers, as much as I would love for there to be additional resources, I work in an environment where I do have to make trade-offs, where I do have to think about how I'm being strategic. So if you were going to set up something where you were trying to anticipate who's going to be a long-term stayer and how to target resources that way, how would you go about it?
I think it's hard. I mean, I think that, we tried that in the family options study. We tried dividing people. We tried dividing our sample of 2,200 families into those that appeared to have greater challenges, either greater challenges achieving housing instability, or greater challenge or greater psychosocial challenges, and we thought that would help us figure out which families needed more intensive services, but it didn't. When we analyzed the impacts of vouchers, of transitional housing, of rapid rehousing, when we analyze the impacts on, on these two parts of the sample, we found there was no difference. So what I'm saying is that the problem that you're describing is difficult. I mean, people are working on it. Beth, my co-author, continues to work on this, on statistical models that help predict who is going to either fall into homelessness, or once homelessness have a harder time leaving it. But we keep coming back to to a few fundamental things that and a lot of them have to do with what's in the jargon called systems involvement. I mean, having been in the foster care system is a very strong predictor of homelessness. Having been incarcerated is a very strong predictor of homelessness. And so, my view about prevention is that the obvious place to start is with those systems. But you're asking a somewhat different question, which is when you have a family enter the family shelter system in New York, how do you know who's going to need some extra help in order to make their stay in shelter shorter? And I guess I would say just continue to work on that kind of use of the pretty strong data integration that you have in the city. You can continue to work on that for how you can query the integrated data system to figure out which people who enter shelters are likely to be long-term stayers.
One question that came in through the Q&A, Jill, that I wanted to put to you is that maybe, all of us live with this on a day-to-day basis, so maybe you've got a slightly more objective perspective on this. But New York City, as you well know, operates under a right to shelter, one of the few cities in the country that operates under a right to shelter. And that unquestionably has saved many people's lives and improved many people's lives. That's not debatable, but it also has been something of a policy constraint because so much human resource and financial resource go into maintaining that system. And so do you have any, I'm sure you've thought about this, do you have any thoughts about the right to shelter and what the impact is on crafting more creative policies to end homelessness?
Well, in some ways, I think it might be an opportunity. I mean, the shelter system is expensive. The shelter system in New York City is very expensive, and that's typical of family shelters. Is that they require heavy staffing. They typically have a lot of services. So the opportunity, I think, is to look at the trade-offs between continuing to maintain a very large family shelter system and using those resources for housing.
If I can jump in, though,
Please.
I think it actually hugely comes back to this question of political will and the political climate. I probably shouldn't say this as a DHS employee, but was a huge skeptic around the right to shelter for exactly this kind of reason. Until over the last few years visiting family in California, right? Which, the cities there don't have it. And it's staggering, right? And if we had in this climate, if we had what, San Francisco and Los Angeles had, it would be a death sentence for people, right? And those are also wealthy communities. Those are also high cost communities. And there has not been, they struggle potentially even more with affordable housing than we do. New York City does invest billions in real debate about whether or not it's enough, but New York City does invest billions in the affordable housing sector. So, you know, I have sort of come back to this place of like, the only thing that's worse than the right to shelter is not having the right to shelter.
It's like the Winston Churchill, democracy is the worst form of government except for all the others.
Right. Well, I mean, you know, California, in which my colleagues and I do a lot of work, they're struggling with the issue of whether they need to expand the shelter system. And most people who do research on homelessness, or who, or for that matter, who do advocacy on homelessness, say that you probably don't want to go there. You probably want to focus on getting people into permanent housing.
But that's hard to argue when you've got 70,000 people on the street.
Yeah. But I mean, there's a lot of, you know, talk about, I mean, there's a lot of, again, there's a lot of, there's a lot of you know, in California cities, there is also a lot of demonizing of homelessness. And part of it is, you know, let's open some shelters and get people off the street so we don't have to look at them. I mean, that, but there's, and, you know, and Molly, you talked about doubling up. You know, people, there probably is a lot of hidden family homelessness in the California cities. People who aren't, I mean, they're not counted in the point in time counts because they're not visible, but they're sleeping, they're taking turns sleeping in somebody's house or somebody else's house, or they're sleeping in the backyard. But you know, but the question is what to do about that. And I don't know that I don't know that right to shelter would be the right way to address that problem.
I mean, in New York City, we have more than 500,000 households who earn less than $30,000 a year and pay more than 50% of their income in rent, right? So that is the narrowest definition of at risk that you can possibly come up with, right? It doesn't include that household that earns 31,000 or the household that pays 49% of their income in rent, right? And they are, you know, just as challenged. So that's 500,000 households. In a lot of ways, it's really kind of remarkable that we have, you know, that the shelter population is only as big as it is. And I mean, I am the biggest cheerleader for affordable housing you are going to find. I have spent most of my career in affordable housing, but I absolutely believe that we need a strong shelter system that provides, you know, good quality services until we are building at a scale that is orders and orders of magnitude different than what we've got now.
Thank you. Thank you for that, Molly. Before I ask a final question to Jill, I do want to remind participants that at the end of this webinar, there will be a survey that will pop up on your screen, and we would request that everybody complete the survey and give us some feedback. We use the information we collect from these surveys to design future webinars, and so would love to give you the opportunity to give us some feedback on your opinions about this webinar today. A final question for Jill. I want to return to something you teed up earlier that we haven't pursued, which is the impact of COVID on homelessness. And I you know, appreciate that your book was published, or at least it was in final galleys before COVID happened. But you had mentioned before that there was a differential impact of COVID on individuals and families. So if you could speak to that and any other comments you have about how you think COVID has impacted the homeless services system, and moving forward, what long-term impacts you think it might have.
Yeah, well, we know that because of the need to deconcentrate shelters, there was a drop in the sheltered population, and that affected both individuals and families. But somewhat to our surprise, as we looked at the data, there was a much bigger drop in the family population than there was in the individual population. And maybe this shouldn't have come as so much of a surprise, family homelessness seems to be more sensitive to economic conditions. During the Great Recession, family homelessness went up during the Great Recession. Individual homelessness did not. And so people losing their jobs was much more likely to affect families than it was to affect individuals. So the pattern here, in which family homelessness went down, and it still hasn't gone back up to pre-pandemic levels. I looked at some data for New York City, and family homelessness dropped between 2020 and 2021, and has not, the numbers haven't rebounded. And then Molly, you probably understand better than I do what's going on here, but when we looked at the national numbers, what we concluded is that the strengthening of the safety net during the pandemic probably had an effect on slowing the inflow into family homelessness. There was the eviction moratorium. There were extended unemployment insurance benefits. There was a much more robust child care tax credit, and we think that all of those things really demonstrate the point that that strengthening the social safety net actually has an effect on preventing homelessness.
Some of us in New York believe that part of the reason why we had increases in individual homelessness over the pandemic was because of the kind of the closing of the front door of some of the hospitals and emergency departments that were focused on the medical crisis at the moment. And so we ended up with a larger percentage of people living with serious mental illness who were not being served in those systems. Have you found any evidence that that was the case?
I don't know. I mean, individual homeless or sheltered individual homelessness did go down somewhat in New York City between 2020 and 2021, and went down more between 2021 and 2022. And perhaps that the phenomenon that you're talking about may have something to do with it.
Well, thank you very much. I want to thank Jill, David, Dennis, and Molly for an outstanding panel that I think provided a huge amount of information to folks. I do want to pause for a moment. I see, Dennis, you've raised your hand. Do you have a comment or a question?
Yeah, because I was a little bit remiss, and my colleague Rhonda, she will be very upset with me because there was a lot of mentions of families and children, but I at least wanted to give Dr. Khadduri just to ask her to speak specifically about children in shelter, because I'm thinking of the quote that my colleague Rhonda always says by James Baldwin: "These are all our children. We will profit by or pay for whatever they become."
Thank you for that question, Dennis. Jill, any comments on the impact of being on shelter on children?
I don't think it's good. I think this is one of the reasons that that it's important that while it may be having a family shelter system is important, but trying to make those stays in shelter as short as possible for children is really essential. I mean, one of the things that we found when we did qualitative interviews for the family options study is being in shelter disrupts parenting. It's disempowering for parents, and it's you know, and from the standpoint of children, it's you know, it's unstable what we found. I mean, I talked a little bit about these radiating benefits. People who were able to use a voucher subsidy, the kids had less absenteeism from school, and change schools less, and change schools less often. And so you know, so that's, so I didn't know. Dennis, do you may have a further perspective on this from, you know, from your observations about
Yeah.
from your personal experience about having experienced homelessness as a child.
That's one of the reasons why I was thankful that you actually spotlighted, you know, families, because I had actually forgot. As I was reading the book, I was like, oh yeah, you know, I was actually homeless as a child too. So I experienced it as a child, as an adult. And I mean, it's something I want to delve deeper into, but sometimes I wonder if there's some correlation. Was there things that I experienced, certain traumas that somehow, you know, manifested themselves when I got older? But I guess that's a conversation for another time.
Well, you know, that does actually raise an interesting possible topic for a future webinar, because we do have a significant literature on adverse childhood experiences, and certainly many of the experiences that lead up to a family going into shelter, and perhaps even the experience of being in shelter, is one of those adverse childhood experiences. And those, the number of adverse childhood experiences you have increases not only bad outcomes in sort of the psychosocial future of the child, but also even medical outcomes, which is quite a striking finding. So that's maybe a good topic for a future webinar. Thank you for that, Dennis. So once again, thank you, Jill Khadduri, David Brand, M.A. Dennis, and Molly Wasow Park. Please, for participants, complete the survey when we close out this afternoon. We want to thank you for the time you gave us today. Thank the panelists and thank the participants. I think this has been a wonderful conversation, and let's continue to fight to end homelessness. Thank you.
Thank you.
Thank you, everyone.
Thank you, everyone.
Take care.